This is Bethany Morton. I'm going to talk about the arthrokinematics of the humerus on the glenoid fossa of the scapula. We can see looking closer that the humeral head rolls superiorly and glides inferiorly during abduction of the shoulder. This is due to the convex-concave rule, which says when a convex surface is moving on a concave surface, the roll and glide will be in opposite directions. Those are the arthrokinematics of the humerus and scapula in shoulder abduction.
Hey everyone. For the muscles involved in shoulder abduction, specifically at the glenohumeral joint, the agonist is going to be the deltoid, which is going to pull directly out and up, creating that abduction movement. It is going to be contracting concentrically with the supraspinatus, which is also going to create the movement, as well as providing a little bit of external rotation at the very peak of the movement to prevent any impingement on the subacromial arch. Working against them is going to be the rest of your rotator cuff muscles, the subscapularis, the teres minor, and the infraspinatus, which is going to provide some dynamic stabilization to keep the head of the humerus in that glenoid fossa.
This is Quinten. I'll be going over the force couples acting on the scapula during active shoulder abduction. The upper and lower traps and serratus anterior are the two primary forces acting on the scapula during normal active shoulder abduction. The rhomboids and levator scap will help to assist the movement. As I approach 180 degrees, the serratus anterior is more heavily involved due to it having a greater moment arm than the trapezius. The trapezius and serratus anterior are acting as synergists. If either one of these muscles acted in isolation, control of the scapula would be hindered, and or there would be significant lateral translation of the scapula instead of the effective upward rotation. These synergist muscles are going to concentrically contract to perform active abduction against gravity.
Hey guys, my name is Charlton, and I'm going to be talking about active shoulder abduction and then osteokinematics. So what's going on in the GH joint is there's abduction, and then there's also slight external rotation and range of motion. For abduction is the AP axis and the frontal plane. For external rotation, it's the longitudinal axis and then in the transverse plane. What's going on in the ST joint is a few things, which is upper rotation, elevation, scapular abduction, protraction, and then also posterior tilting. For upper rotation, it's the AP axis and the transverse plane, elevation, AP axis and the frontal plane, protraction, external rotation, or vertical axis and the transverse plane. Posterior tilting is the coronal axis and sagittal plane. Abduction is the frontal plane and the AP axis.
Hi, my name is Mikayla Riar. I'll be explaining range of motion of shoulder abduction. From 0 to 30 degrees, it is still a glenohumeral movement. After that, for every 2 degrees of glenohumeral motion, there's a 1 degree of scapulothoracic motion, according to scapulohumeral rhythm and the 2-to-1 ratio. The glenohumeral joint contributes to 90 to 120 degrees of abduction, while the scapulothoracic joint contributes to 60 degrees of upward rotation, together producing a max range of motion of 150 to 180 degrees of abduction. There's a slight external rotation of the humerus at end range, and we also see a posterior tilting of the scapula throughout the motion. These adjustments contribute to maintaining the subacromial space here and optimal contact of the head humerus and the glenoid fossa of the scapula.
Hello, my name is Alvin Cherian. To summarize, we see that the roll and glide is in opposite motion with a superior roll and inferior glide. The motion is shoulder abduction with a small amount of external rotation towards the end of range with the glenohumeral and scapulothoracic joint adjusting to achieve this range, specifically with the scapula being able to move in the three cardinal planes and axes. Looking at the muscles, we see that it is primarily the work of the middle deltoid to abduct the arm horizontally and the supraspinatus, which is located posteriorly on the scapula, to work synergistically with that muscle. We're also able to see the different types of muscles that are activated at different angles of shoulder abduction. Thank you for watching and listening to our presentation about the different kinematics, muscles, force couples, and range of motion which is involved in shoulder abduction. We hope you enjoyed.